A little bit of everything, little trash, recycle, linen. Sometimes we have compost, and I think I may be able to get it all on one load here.
The Healthcare Career Advancement Program, Hcap Green Project, was a collaboration between union locals and 11 employers. It was implemented in 4 regions across the United States. The goals were to bring unions and employers together to reduce the industry's carbon footprint, prepare workers for greening their work, and move workers into new jobs that support environmental sustainability.
In Seattle, people really care about the environment and about recycling, about being green. You know, when you learn all the opportunities to save money, to be safer, and it's good for the environment.
Northwest Hospital is located about 8 miles north of downtown Seattle, and it's a community hospital that is licensed for 281 beds.
Hey, good morning, Mayor.
A few years ago, it was explained to us that we had an opportunity to be part of a national training fund to help train our employees to gain more skills. The hospital, I'm convinced, benefited tremendously from this training.
Got some recycle here.
An engaged workforce helps lower the hospital's carbon footprint and supports change needed for a healthier and greener institution.
The big plus with an electric gator is 0 emissions.
Engaged workers, their union, and enlightened management can achieve a triple bottom line: a healthier planet, a healthier community, including patients and workers, and a healthier bottom line for employers. As the partners work together, they're improving labor management relations in general.
Maybe at the next Green Team meeting, we can start pushing it.
I think that's a good idea.
Hcap was the lead national organization. It partnered with the Labor Management Initiative out of New York, which provided training and support for participating labor management collaborations across the country. Hcap developed a core curriculum and instructional methodology for green training that was implemented across the partnership. North Seattle Community College developed a college-level course titled Sustainability in Healthcare, which was also implemented in the 4 regions across the country. Practice Green Health is a national organization that supports environmental sustainability in healthcare, and it served as consultant and subject matter expert to the project. The SEIU Education and Support Fund took the lead, integrating worker health and safety issues into the curriculum, and was a consultant for the Train the Trainer model. What follows is how this innovative project worked in Seattle. Participating SEIU members from Environmental Services, Food and Nutrition, and the Facilities Departments at Northwest Hospital all completed the green training over 2011 and 2012. They learned about which cleaning chemicals are toxic and ways to reduce waste of all kinds. They learned about fuel consumption, water conservation, and why hospitals are currently among a community's biggest polluters. The curriculum built in basic science, math, language, and vocabulary as well.
I went to the green classes, and I was amazed at what I didn't know.
Northwest Hospital's labor management committees worked together to set measurable goals for participating hospital departments to actually improve their triple bottom line: people, profit, and planet. With the help of the national project team, the locally developed goals were directly woven into the green training itself. The goals were to use less toxic cleaners, to improve composting, and to increase recycling.
We had a purpose and we had their goals, and then our job was to create the curriculum that helped the hospital achieve its goals and allow the workers to grow in their green knowledge and personally fulfill a project that met that goal, giving them the satisfaction that they could help the planet, save their hospital money, and increase their own knowledge base. And it worked beautifully.
The basic green training is facilitated by employer-supervisor training pairs. Worker-supervisor pairs attended a Train the Trainer course to become peer trainers. Train the Trainer introduces principles of adult learning, co-facilitation and presentation, and provides opportunities to practice these skills in a supportive environment. Trainers also learn techniques for working with adult English language learners and participants with low literacy. When the training ends, the teams are prepared to deliver green training modules to their colleagues. These trainers also become institutional resources to support future training in their departments and throughout the hospital. With the help of these peer trainers, over 300 workers and managers at Northwest Hospital have completed green training. Housekeepers, food service workers, groundskeepers, and facilities maintenance staff.
I thought it was just a rumor. They said something was coming through the hospital that the union had something to do with, and they asked, did you want to get on board? And I was like, no. And then I was like, and then it kept coming through, and I was like, okay, let me give it a shot. So I gave it a shot and got on board with the green training. It was great. You learn so much.
My job here in this room is to make sure that everything stays green here and people are following that. So this goes in the recycle, recycle, recycle.
Many of the workers were so engaged, they decided to continue their education by enrolling in the 5-credit college class called Sustainability in Healthcare. It was offered through nearby North Seattle Community College. As part of that class, workers completed a research project. They presented their findings to a public audience that included supervisors, fellow union members, and union leadership.
I did a lot of research, a lot of computer, and I'm not used to computers, not going into internet and going into it to discover and history and science and all those things. So that's what we did in the classes. We got used to scientific terminology, the science terminology.
Deanna, she did a lot of research and did a presentation and project around ATP, or the ATP meter, which we have subsequently adopted as our QA metric.
That's right. Yeah. There's been no quality check because when you walk into a room, well, it looks clean. Yeah, I just cleaned it. But how clean is clean? So that's what this tool provides us. It measures the RLUs or the germ or what is left on a surface. This is a program that we need. We got to keep it, and especially for our department because we're in the waste management, we're in the cleaning, we need a quality control device.
Deanna is the ATP guru, so to speak.
Cleaner rooms mean fewer hospital-acquired infections. That's a tangible benefit to patients, workers, and to Northwest Hospital. There are less tangible but just as important benefits too.
I think management here has a new level of respect precisely because environmental service workers are now more willing to speak out.
The curriculum started with what is it that you observe every day that bothers you about waste. We took chemistry, we took data, we took all kinds of very kind of college level thinking and really connected it with what were the projects that they were most interested in.
Okay, my name is Guadalupe Gonzalez and I am housekeeper. I worked here for 5 years.
Guadalupe partnered with Karen and they looked at the waste in patient rooms because they would go into a patient room day after day and see that all of these different patient care items were encased in all this plastic, and as nursing assistant would bring them all these supplies and then they would just not be used. And because they had been in contact in a patient room, technically you can't reuse them. And so their focus was really in how do we educate the nursing staff to not bring so much stuff into the room so that then you don't have to throw away all of that stuff.
I feel more confident. I feel like a little more happy because I think I do something good and I feel good.
Hi Mary, how are things? Being able to see my staff grow and develop. Them having the knowledge and the confidence to talk to and approach someone outside of our departments, you know, a nurse or even a doctor, and letting them know what the correct and appropriate processes are.
These are the Johnson controls, variable speed drives for the fans.
We've got a current measuring device.
Because everything's behind the scenes, and we work with all the mechanical systems and the plumbing system, everything that's behind the walls. And this is when I always say, hey, we are the heart of the hospital, because without electricity, without heat and air conditioning, all the services basically cease.
The goal for the part I did was to lower the electrical cost of the lighting in our garage. We have 150 watt bulbs that the savings that would come out of that would cut the cost almost in half.
The parking garage, I think in the end, $36,000 to do a retrofit to new all LEDs, the whole thing. And I was like, wow, that's really a lot of money. But to find out that we're going to get a return within 5 years, that was pretty darn amazing.
Green trainer, after taking the class, we are saving a lot of money on wasting food. Before, this thing was overflowing.
As far as department leadership, we were making decisions about our food choices and our waste and composting activities, but I don't feel we were doing the best job of bringing the staff up to speed about why we were doing these things.
There was me, Bill Klinger, Joe Nix. We decided on overproduction of food was going to be our class project as far as creating a business plan.
We have a 6-week menu cycle, and we basically look back at how much food was produced each day and how much food was composted at the end of the day.
Most of us, I think, feel that it's middle management and managers that would drive our department and drive the profitability of our company as far as being accountable for it. And we've taken a step back and taken responsibility back onto ourselves.
So here is the compost bin.
The first year we started weighing our waste, we were able to calculate that we saved $44,000, which is a nice chunk of change.
While they were working on projects and curricula, the union and the hospital were also negotiating a new job title. Called Green Coordinators, 2 workers were promoted into positions where they could really focus on greening Northwest Hospital.
The Green Coordinator, it's a promotion, absolutely. It's not just a name slapped on you and you get 50 cents more an hour. You're responsible for helping people, greening up their programs. So we're collaborating. We're not fighting each other. We're all collaborating on getting these things in place.
The program made a big difference on all 3 goals: people, planet, and profit. It developed a frontline workforce proud of creating a sustainable environment and quality healthcare system. Participants also become more aware of the need for change and creative problem solving. Tangible early outcomes include the reduction of the institution's carbon footprint and cost savings that will increase as the programs are sustained and expanded.
We have that team approach with the doctors, with the nurses, are hand in hand with a housekeeper. There's no one that's more important or less important in the care process. And that was reinforced to the housekeeping department, to food nutrition, and to facilities during this green training. Everyone plays that crucial role.
So the class changed the way that the people think about what they're looking at. They go out and say, if we could change this, how's that going to help?
We're not only improving the lives of these healthcare workers by providing career ladder opportunities, but improving healthcare and healthcare delivery overall.
This green grant is just a good example of we can recognize mutual goals and we can pursue them and still maintain our own interests as labor management, but work forward in a way that's productive.
For more information, visit Hcap.